Welcome to the Group Health Benefits Open Enrollment Webinar. Thank you for taking time to join us today. I'm Robert Besser, your Conference Treasurer and Benefits Officer. Today's session is being recorded so that you can revisit it later or share it with others who may not be able to attend live. Our agenda today is divided into two parts. First, an overview of the Group Health Benefits Insurance Plan, highlighting the minor changes from 2025 to 2026. The second part is a deeper dive into our Wellness Plus program. The Wellness Plus program continues to be an important part of our overall health benefits plan. Before we begin, I'd like to take a few moments to explain how our group health benefits plan works and why it is important to each of us. Let me share with you the difference between self-funded versus fully funded plans. As you know, we are a self-funded plan. Here's what that means. I'm going to use a simple analogy to make it clear. I'd like for you to think about your electric bill at your house. If in the summer, you set your thermostat at 66 degrees, your air conditioner runs almost nonstop. Add in an electric water heater that is set to the highest temperature, poor insulation in the attic and in the walls, incandescent light bulbs on all day long. Your electric bill would be pretty high. Now imagine a home with better insulation, with LED lights, with energy-efficient appliances, and a more reasonable thermostat setting. That home's electric bill would be lower and more consistent over time. Our health plan works much the same way. Because we are self-funded, there isn't another insurance company. We, the Texas Annual Conference, we are the insurance company. We are the ones controlling the cost. The more wisely and efficiently we use our healthcare services, the more it is that we all save. When you shop around for gas or for groceries, you might compare prices between Costco and Sam's Club and HEB and Kroger and Walmart and your corner grocery store. When you shop around, you're a smart shopper. That same principle applies to healthcare. When we all make wise choices, such as using in-network providers, telehealth when possible, using the emergency rooms for true emergencies, when managing chronic conditions effectively, when we do all of that, we help keep costs down for everybody in the plan. By contrast, that's self-funded plans. By contrast, fully funded plans like HealthFlex or other corporate models, they operate on a more like a flat rate subscription. Think about your internet or your streaming services or your cable bill at home. In most instances, it doesn't matter how often you use it. It's the same cost every month. Those companies build everyone's usage into a single rate, and they pass that rate along to their customers. In our self-funded insurance model, we are the insurance company. If claims and cost are high, then the rates rise for everyone. If we stay healthy and if we make smart decisions, our costs stay low. And that is exactly what we've seen happening. Hear this. Over the past 8 years, since 2018, our cost per clergy person per year, PEPY, per employee per year, per clergy per year, is now at the lowest rate that we've seen since 2018. Let me say that again. Even though insurance rates have steadily increased across the nation, the cost per employee per year are the lowest since we've seen 2018. I challenge you to find any annual conference, any self-funded or fully funded plan who are able to say that their cost per employee per year are close to the same amount as their rate was in 2018. Friends, in 2023, it was $29,012 a person per employee, per clergy person. In 2024, that rate was down $26,909. On average, for 2025, we're barely under $22,000 a year per clergy person or per employee per year. That is a direct reflection of your stewardship, your healthy choices, and the dedicated work of our benefits team, our group health benefits committee, and our vendor partners all working together. Our shared commitment to managing this plan well is paying off. So please, pay special attention to the Wellness Plus portion of today's webinar. The more we engage in programs that help get us healthy and help keep us healthy, the better overall our results, better in our personal health and better in our collective cost. Now, there are several people on this webinar who helped make this plan possible and who will share updates with you today. Marianela Morales manages our group health benefits for all clergy, lay staff, and their families. She does an outstanding job year-round. The information and the resources that she shares through the monthly newsletter, the highlights of the mental health assistance, the employee assistance program, the EAP, Teledoc, the 8 tools that are available in Wellness Plus, which include gym membership and home delivery of groceries, and many more tools that she shares. All of those help us all to reduce our cost. Next time you talk to Marianela or see her, please join me in thanking her for her dedicated and exemplary service. Next, Patricia Goforth-Rakes. Patricia manages our retiree health benefits. For those of you who are retired under the age 65 and who participate in the conference plan, or whose spouse is under 65 and take advantage of our plan, please take a moment to thank Patricia for her authentic work and her faithful care when you see her or talk to her next. Mark Hellums, our fiscal and benefits controller, who will share a brief presentation later in the session. Mark has a gift for making complex financial information easy to understand. And we are also joined today by our trusted partners and vendors who help us manage and support the plan. Our Alira group, our benefits consulting team, Ryan Johnson, Chris Sunseri, and Renee Stately all help us as a vendor. Apta Health Care Coordinators, Cali Johnson, will have a presentation. Custom Rewards, One Past Select UMR, Lisa Ford will make a presentation. Real Appeal, Christopher Rico. From RX Benefits, Express Scripts, Nikisha Montgomery and Devon Reisinger. From Tria Health, Doug Montgomery. And from Resources for Living, EAP, Gina Mayer. Each of these partners are here to serve you, our clergy, our lay staff, spouses, and families. Their goal and our goal is to make this plan the best possible version of group health coverage in the Texas Annual Conference. Now, before we move to the presentations, let me share a couple quick reminders. Tomorrow we'll host 2 additional webinars. I don't want you to miss them. The high deductible plan overview with Ryan Johnson begins at 1 o'clock. The Medicare enrollment session with Michael Steele begins at 2 o'clock. And then there's one more important webinar I want you to make note of. The Pension Transition Webinar. Patricia Goforth-Rakes, Mark Hellums, and myself will host this session 1 week from today, next Tuesday at 1 o'clock. We'll discuss the transition from the WestPath's CRISP pension plan to the Compass plan. All clergy who are enrolled in the WestPath plan and the church payroll staff are strongly encouraged to attend next Tuesday at 1 o'clock. Friends, as we move forward, remember this. Because we are self-funded, our choices matter. Every healthy habit, every wise medical decision, every engaged participant helps us sustain affordable and effective health coverage for our entire conference family. Now, this is a webinar. As such, you're able to ask questions by typing them in the Q&A at any time. If you have a question, don't wait, type it. Type and submit. At the end of each presenter's presentation, we'll pause to answer your questions along with that presentation. Note, if you submit a question, your name will not be shared. In other words, we won't say your name is raising this question. We'll answer the question without sharing who is asking the question. I want to begin with a word of prayer, and then we'll begin with Mark Hellums sharing an overview. So let us pray. Gracious and loving God, we give you thanks for this day, for the gift of health, for minds that think, for hearts that care, for bodies that serve in your name. As we gather for this webinar, we remember that every plan we make, every benefit we offer, every decision we take is not only about policies and numbers, but it's about people. It's about your people. Those who lead, those who teach, those who preach, those who serve, those who love and support them along the way. God bless their time together. Bless our conversation and our learning, that what we discussed today might promote wholeness and peace of mind and well-being for all who serve you through the ministry of the Texas Annual Conference. We thank you for the hands and the heart that make our health plan possible. For Marianela, for Patricia, for Mark, for our partners, our vendors, for the Group Health Benefits Committee, and for every person whose quiet work keeps this ministry of care going strong. Teach us to be good stewards of your health that you've given us, wise in our choices, faithful in our habits, and grateful for the grace that sustains us each and every day. May all that we do here honor you, and may it strengthen the body of Christ, the church that you call to thrive in clarity, in witness, in abundance, in kinship, and in joy. We ask these things in the name of the great healer, Jesus Christ, our Lord. Amen. Mark?
I apologize. Apparently, I'm having difficulty with my computer in the sound. I want to go through the rate schedule that's in effect for January 1, 2026 for our group health plan. Okay, what we're looking at right now is the active clergy rates in effect for both the high deductible plan as well as the standard PPO plan. You can see the high deductible plan and the standard PPO plan. Both of these rates are unchanged from the prior year. Clergy coverage under the high deductible plan is 3.25, clergy and spouse 7.1, clergy and children 5.45, and clergy and family 9.65. Under the standard plan, these rates are the same as last year, no change in year over year. Clergy at 6.75, clergy and spouse at 13.3, and clergy children 10.35, and clergy and family 15.65. The church contribution rate remains at 14%, so no change in terms of what the church will contribute towards monthly premiums. In terms of the TAC lay employees, Here's the amounts. These are fixed dollar amounts that will be in effect for 2026. Again, there's no change from 25. Under the high deductible plan, employee only coverage, there's no out-of-pocket costs for employee only coverage. Employee spouse will be $600, employee and children $200, employee and family $800. On the standard PPO plan, employee only coverage will be $200 per month, employee and spouse $850, employee and children $300, and employee and family $1,150 per month. With respect to the Humana Dental and Vision, effective January 1, there will be a slight increase in the dental premiums. However, there will be no change in the vision premiums. We have established a 2-year guarantee on both the Humana Dental and the Vision plan. So when you look at these figures, these will be what's in effect for 2026 as well as 2027. The employee only on dental is up slightly to 30.61, employee and spouse 68.25, employee and children 65.43, and the employee and the family rate is $104.98. And again, the vision plan, there is no change from the prior year. Last is the early retirees, the under 65 group. There are no rate changes in terms of what the monthly premiums will be for this group. The retiree only under high deductible, $450, retiree and spouse, $1,050 per month, retiree and children, $650, and retiree and family, $1,250. The standard PPO plan, $650, retiree only, $1,500 per month for retiree and spouse, retiree and children coverage, $950 per month, and then family coverage, $1,800 per month for the standard PPO plan. Thank you, and now I'm going to turn it back to Marianela.
Thank you, Mark. Okay, I'm going to be going over plan changes for next year. The first thing is, if you are going to make changes during open enrollment is November 1st through the 15th. Is our annual open enrollment period for the Texas Annual Conference Group Health Benefits Plan. If you are planning on making a change to your current 2025 benefits, you must submit an enrollment form to our office, okay, no later than November 15th. If you're not planning on doing any changes at all, whether it is your coverage or your dependents, you do not need to submit an open enrollment form. We would just carry your current enrollments into 2026. An electronic version of the open enrollment packet has been mailed, and the electronic copy is in our website. We're going to go in a few minutes to the website so that you know where to find it in case you would like to save an electronic copy. For this year and preparing for 2026, we're asking that the enrolled participant, the employee, okay, the primary policyholder, calls Apta Health during open enrollment or before December 31st of this year, and that they go over questions over the phone with the care coordinators regarding if the employee or the family members have any other coverages. This question will be saved in your account for next year, and we're trying to do this proactively so that we eliminate possible claims delay in 26. So you can start calling them as soon as today. Their phone number is in the back of your ID card. However, it's also here on this slide. They're available Monday through Friday, 7:30 to 9 p.m. Okay, the first plan change for 2026 is going to be in the standard PPO plan. Effective January 1, we're adding a copay to urgent care visits for in-network only. This will eliminate the current deductibles and co-insurance for these visits. And then also, effective January 1, 2026, we're adding a copay of $250 to in-network and out-of-network emergency room visits. plus any deductibles or coinsurance. However, if admitted to the hospital, the copay will be waived and the claim will be subject to the deductible and coinsurance. If you have any questions, please start posting those in the Q&A. But I want to make sure that we distinguish what is a urgent care versus a hospital ER or also a standalone ER's facility. Right here, we've seen this around our neighborhoods. It's called neighborhood ER. There's others similar like that. Please know that that right there is not an urgent care facility. It might do what urgent care facilities can do, but just know that they are not an urgent care. To be sure you're in an urgent care facility or location, it must have the word urgent care in their name. For example, Next Level Urgent Care, or Concentra Urgent Care, or Care Now Urgent Care. The word urgent care must be in the name in order for that $50 copay to be applied, and they must be in network. Okay? How do you find in-network urgent cares? Not just urgent care, but any providers in our plan. First, you can take a picture of this QR code. You can go to this QR code. I've put the link there in case you want to know where to find it. But the first thing you do is you go to this website and you scroll all the way to the bottom and you click on View Providers. Hint, if you're looking for a mental health provider, you must select Behavioral Health Directory. If you don't do that, you will not get mental health providers. That's just a FYI on the side. But if you're looking for an urgent care, an ER, hospital, or you're looking at a lab, or you're looking at a specific doctor or specialist, whatever the case may be, this is where you would go. Scroll all the way down to the page and view providers. Then you're going to first put your zip code. So make sure that you hit that change location and you put your current zip code so that it tells you what your location's providers are. And then you're going to click on places. This is for finding an in-network urgent care. So I'm doing a sample of how you would find an urgent care facility. So in this scenario, once you've done your zip code, you're going to click on places. After you click on places, you're going to click on clinics. And then after clinics, you're going to choose urgent care clinic. Once you do that, the program is going to ask you, what is your radius? Do you want to do a 10-mile radius, a 20, 50, etc.? And it will show all your in-network urgent care facilities. I strongly suggest that you do that as soon as possible so that you know that you're going to an in-network urgent care facility or an in-network doctor or an in-network hospital. Okay? That way you know where to go before you need it. And also when you're traveling, you want to know in advance where to go in network. The second change will be, the second plan change for the high deductible plan will be teledoc fees. Effective 1/1/2026, teledoc fees will be $0 for general visits, $0 for mental health visits. These are licensed therapists as well as psychiatrists, and also $0 fee for dermatology visits. And please know that both the standard PPO plan and the high deductible health plan dollar amount will be $0 for both plans as mentioned above, so that both plans have the same fee schedule. And this will take effect January 1 of next year. The next change you need to be aware of is the ACA reporting the 1095B, how to request that. In efforts to reduce waste and promote efficiency, we, the Texas Annual Conference Group Health Plan, we are taking advantage of a new law that allows us to make the 1095Bs upon request. What that means is every year in the first quarter, we would report to the IRS these 1095Bs as a report, right? And then the system will generate paper copies and email to you, okay, without us doing any further into it. It would automatically mail that out to you in the first quarter. starting in 2026, okay, starting the first quarter of 2026, we will still report that. However, if you would like a paper copy or an electronic copy of your 1095B, that will be given to you upon request. Okay, if you're interested in obtaining an electronic copy or a paper copy, please let me know via email, or you can call, or for clergy, this will be available in your People portal to request that to us. And the 1095Bs will be issued to you within 30 days of your request. Also, everyone will be receiving a new ID card. Okay, whether you're in the standard PPO or in the high deductible health plan, please look for a new ID card in the mail in the first quarter of the year. You can also download your Quantum Help mobile app and view your ID card there. Cali Johnson will be sharing to us about that in shortly. So if you need a quick ID card, an electronic copy, I strongly suggest that you download the Quantum app, register if you haven't done so, and you can view your ID card before it's actually even in your door. This is how it's going to look. This is a standard PPO version of the ID card. It will show the $50 copay, and then we're also trying to add the ER $250 copay. I'm going to go towards the questions, the Q&A, and see if there's any questions. I don't see any questions, so we're going to move forward. This is the group health benefits enrollment form for active clergy and lay employees that you must complete if you would like to make a change to your plans. If you don't, please don't do anything during open enrollment. We'll carry your coverages into 26. And then the next, take a photo of this QR code. This is where all open enrollment materials live in our website. This is where we will post this recording, as well as tomorrow's webinar recorded webinar. This is where also you will find electronic copies of all the documents during open enrollment, including the enrollment form to make changes, as well as an electronic copy of your packet for both active, lay, and under 65. Without further ado, I'm going to first introduce you to Cali Johnson. We're going to transition into our second part of this webinar, which will be we'll be inviting all the wonderful vendors that we work with day and day. We're going to hear about the different types of plans that are out there, solutions that are out there for you in the group health benefits plan. The first is Cali Johnson. She's our Apta Health Care Coordinator. And Cali Johnson, the floor is yours. Thank you.
Thanks, Marianela. Let me go ahead and share my screen. Right. Can everyone see a yellow box? I'm looking at it, so thank you. Thank you so much. All right, so at Apta, we've been around for Texas Annual Conference for a few years now, and we're a care coordination, healthcare navigation, and patient advocacy program. And we help with everything from getting that new ID card, like Marianela mentioned, to helping you through a major healthcare issue like a life-changing medical diagnosis. Now, regardless of whatever your concern is, we want to help you navigate your healthcare journey as easily as possible. We've simplified the member experience by giving you one ID card, one phone number to call, one dedicated service team that is equipped with the training to give you a better experience. We've got one member website and one mobile app. We'll talk more in detail about all of those things. The first thing we're going to review is the dedicated support team that you have, which are our care coordinators. These care coordinators are located in Columbus, Ohio, and they're here to help you navigate the confusion surrounding the healthcare system, helping you with anything from ID cards to that major medical issue. You can reach them using this phone number, which is also on the back of your ID card. They're available 7:30 a.m. until 9 p.m. Monday through Friday. I do highly recommend saving this phone number in your phone. That way you can easily access it when you need it, as well as if they ever need to make a phone call to you, then your phone won't block calls as spam. I know we all have that great technology, super helpful, unless you need a phone call from a care coordinator. So watch out for those phone calls. These care coordinators, they act as your single point of contact with any benefit questions. So whether you have a question on how does my deductible work, how does this claim pay, you've got your EOB and you need help understanding and reviewing that, finding an in-network doctor, getting pre-certifications on file, all those really exciting things they can help you with. In addition to being available over the phone, the care coordinators are available for scheduled phone calls that you can make on the web portal and on the mobile app. And there's also live chat available on the web portal as well, if that's easier and more convenient for you. Our care coordinators, they're organized into what we call a pod. The pod allows them to give you that personalized member service while collaborating with each other to share in all of their expertise that they have. Within the pod, there are about 25 care coordinators, and the ones you're most often going to speak to are the patient service representatives. Those are the frontline folks that are going to be answering the phone. There are benefit and claims specialists. You might also interact with a personal care guide, who's a dedicated nurse that will help you through a complex health condition or complex medical situation. We also have physicians, pharmacists, and social workers on staff to help support the pod. Now with Apta, we do champion a primary care driven model, so we do encourage you to coordinate your care through your primary care doctor. We found that patients with a primary care physician tend to have better management of their chronic diseases, lower overall healthcare costs, and a higher level of satisfaction with their healthcare. With the cost to see a specialist often 3 times as much as that of a primary care physician, we want to make sure that you aren't on the hook for any unnecessary charges. So we want to help you get a referral from your primary care physician on file before you see a specialist whenever possible. Your doctor can simply call that in to the care coordinators using the phone number on the back of your ID card to get that on file. And that's supposed to help you, we're trying to help you avoid seeing that incorrect specialist or even accidentally using an out-of-network provider. The referral on file is valid for 12 months once you've got it. So it's just something that you would do once a year to get that back on file. Now, real quickly, I'll touch on pre-certifications. This is just a reminder, as again, nothing here is changing, but just so that you're aware, if you have any of these services listed here coming up in 2026 or even in 2025 and you're on the health plan, make sure that you reach out to your care coordinator as soon as possible to discuss any of these services, because a pre-certification will be required to make sure that you're not penalized for not having this previously authorized. So really, if you have anything like this, even on the horizon, just go ahead and call the care coordinators and they can definitely help you out. Now, as we alluded to earlier, there is one dedicated web portal for Texas Annual Conference. The website is simply tac.myaptahealth.com. And the site has everything that you might expect and a little bit more. They have a dashboard with links to help you get to your claims, your EOBs, your plan document. You can search for in-network providers, but you can also have an online chat with a care coordinator or pre-schedule a phone call with a personal care guide or with a care coordinator. As Marianela mentioned, we do have this Quantum mobile app as well. And this is kind of a pared down version of the web portal. The app is available on the Apple App Store or Google Play Store. And this is a great tool to have downloaded and ready to go because you can get your ID card right here. That way, if you don't have your ID card in your wallet, in your purse, then you can just pull up this mobile app and get your ID card out for your doctor. So it's nice and simple. Now we'll switch and talk a little bit about a program that we call Apta Cash. And this is a program that you already have in place. So again, if you are on the health plan and something here strikes your interest, be sure to reach out and we can help you navigate this. So with AptaCash, how this works is it's going to help you save significantly on your healthcare procedures, things like surgeries, colonoscopies, endoscopies, MRIs, CAT scans, labor and delivery for maternity care, all those sorts of things. And with AptaCash, what happens is once you reach out to the number listed here, or you can call the care coordinators again, and they'll transfer you. AptaCash is going to work with your provider to try to negotiate a lower upfront cash pay rate for a procedure. If your provider won't negotiate a cash pay rate, you can still use your plan with them like normal, or you can switch to another high value provider that we can help you find and that will negotiate with us. Now, what's in it for you? By using this program, you reduce your costs for whatever the service is, be it an MRI, an endoscopy, a surgery. If you're on the PPO plan, you'll pay nothing for any service that goes through AptaCash. So you're avoiding your deductible and coinsurance. On the high deductible health plan, you only have to meet the IRS minimum deductible, and then you're 100% covered. So there's no coinsurance to worry about there. So this is definitely a way that you are able to save some money while making sure that your healthcare needs are met. Last but not least, we have your wellness coaching options. These are in your plan, and so if they sound interesting, don't hesitate to reach out again to the care coordinators to get enrolled. The first program is the health coaching program, where you'll be assigned to a health coach that'll help you navigate healthy eating, weight management, and being more physically active, stuff like that. We also have your early steps maternity program, and this helps women who are expecting at all stages of pregnancy, both through the pregnancy and postpartum. So if that is you, if you have somebody on the plan that this would qualify for, make sure that you're letting them know to connect with the Early Steps Maternity Program through their care coordinator. And last but certainly not least, we have the Tobacco Cessation Program, which gives you support and resources to quit using tobacco. And we see a 53% quit rate after completion of the tobacco cessation program. So it's very successful and something where if you're interested, we would highly encourage you to reach out to your care coordinators. If you take one thing away from this whole presentation, then you'll want to reach out to your care coordinators whenever you're starting any step in your healthcare journey. They're always going to be there for you. So please do give them a call. I'll hand it back to you now, Marianela.
Thank you so much, Cali. I don't see any comments or any questions here in the Q&A. So we will go ahead and move forward with the next presentation that we have. The next presentation will be from Ms. Lisa Ford. She will talk about custom rewards, the preventive care gift cards, and OnePass Select. So Lisa, the floor is yours.
Okay, hi everyone. I'm going to share my screen. Just let me know. Okay, can everyone see that?
Yes, ma'am.
Can everyone see my screen? Okay.
Yes, ma'am.
Hi, I'm Lisa Ford. I'm the Field Account Manager assigned to Texas Annual Conference. And today I'm going to be going over your UMR incentive solutions. Okay, so Texas Annual Conference offers an opportunity for everyone to be able to earn money by just doing healthy options. So they're committed to helping you live a healthier life. And this year they offer an opportunity to earn up to $175 by just completing your annual wellness visits. And that will include your particular screenings for just age-related screenings. So for that would be breast cancer, your preventive screenings, which means your annual exam, and your colorectal screenings and things of that nature. So you will be able to earn a gift card for just completing those particular screenings. So the gift card comes in the mail. It's a MasterCard, and you're able to use that gift card at any of the merchants that take MasterCard. There's the stipulation on the usage. You're not able to utilize that card for alcohol, tobacco, or any type of gaming. So I just want to put that out there. And it's a prepaid reward card that comes in the mail. And just be mindful, it takes about 4 to 6 weeks to process after you've completed your screening, and that screening is then processed as a claim. So here it just shows you how you're able to earn some of the money, and it's up to $175. So once you reach that $175, that's the maximum award amount, and you can earn it by completing different things. So you'll have your annual screening where you can earn $75, for instance, and then if you do a breast cancer screening, you can earn an additional $50. And each of those screenings will come on its own prepaid one-time load card. And that is eligible for the employees, the retirees, the spouses, and dependents 18 years and above. In the card, you also have contact information. If your card is lost or stolen, there's a 800 number on the back of the card that you can reach out to for help. And there is an expiration date similar to credit cards that you would get or debit cards that has that expiration date on it. So I just want to be mindful to let you know that the card does come in a pretty generic envelope. It's not any markings on it. It does not say UMR, doesn't say reward card or anything. So I know we get a lot of junk mail. So just be mindful of and be on the lookout about 4 to 7 weeks after you've completed your wellness screenings. Okay. So that is it for the incentive solutions. Are there any questions on that?
No questions so far, Lisa. You can proceed with the OnePass.
Okay, so let me reshare. Okay, can everyone see the OnePass there?
Yes.
Okay, so what is OnePass Select? So OnePass Select lets employees choose the best health options for them. And it gives them an opportunity to go to different gyms. There's no long-term contracts or annual gym registrations, flexible fitness options, and the ability to use locations nationwide, and you're not limited to just one gym. You can add friends and families at a discounted rate. Option to change tiers monthly. So I'll show you, as you can see, there's listings on the screen where they're showing you different tiers. And there's also a grocery delivery subscription that will be included with your membership. Okay, so here is an example of some of the different gym facilities that are available in the various tiers. So when participating with a digital tier, you have the capability to Fitbit Premium, Fam Huddle, and things of that nature. And as you increase your tier level, you have the access to the gym memberships prior to. So for instance, if you're going to be in a standard tier, if you pay for that standard tier, you'll have access to all of the gyms in the standard tier, as well as the classic and as well as the digital. Okay. OnePass Select additionally offers an application experience that unlocks wellness and activities. It's fully integrated digital, and it's personalized coaching via onboarding surveys, on-demand fitness and wellness classes, a gym finder, and easy to use sign-up process. I would also recommend when you're using the OnePass to check for your gym memberships, because sometimes they do change as far as the tiering. And and OnePass controls that. It gives you access to view the gym memberships that you're going to be participating in. And if they change, that will be noted. If there's any type of increase to pricing, all of that information will be sent out directly to the members that are participating in the program. So one of the perks of OnePass, and if you join, you get opportunity to participate with Walmart Plus. And that's a savings there because Walmart's annual fee for Walmart Plus is $98. So by participating in OnePass, you'll have an opportunity to also have a Walmart Plus membership, and that comes with free shipping from Walmart, and there's a opportunity to get a discount on your gas, as well as other perks for viewing membership for either Paramount or Peacock. Also, you can participate in Shipt, and that's free delivery, and that is for orders over $35. And Shipt offers a $99 annual fee. So just by participating in the OnePass Select, you are able to save on Walmart Plus membership as well as Shipt. And that is it. Are there any questions on OnePass?
Yes, there's one question, Lisa.
Okay.
Can you go back to the screen to show the app? There's a question regarding whether this is an app or is it through the website?
Okay, just one moment. I clicked out of it, so, okay. And there is an app, so you can get the OnePass app in the Google Store or Apple Store. Google Play, I believe it's called.
And it is called OnePass, right?
Yes, and it has the little symbol with the O and the P kind of intertwined. That's up at the top right in here.
Thank you. I don't see any other questions.
Okay.
So we can move forward.
Okay, thank you.
Thank you so much, Lisa. That was wonderful. Our next presentation will be from Christopher Rico, and he is here with us today, and he's going to talk about Real Appeal, and that is the weight loss tracker.
Well, thank you so much for having me on your call today, and let me get my screen shared up. And can everyone see my slides?
Yes.
Perfect,
Yes.
Thank you. All right, so what I'm here to talk about today is Real Appeal. I'm one of the client service managers with Real Appeal, and I've been here for just about 10 years now, so I really love everything this program embodies. So Real Appeal is an online weight management program available to you at no additional cost as part of your benefit plan. And the cool thing about this, it's not only available to you, the employee, but also reaches out to your spouse and your dependent kids 18 years and above who are currently under your medical plan as well. So they're able to join at no additional cost as well. So question is, what is Real Appeal? So Real Appeal is everything you need to create healthier habits. So once you become a part of our family, our Real Appeal family, you have supportive coaching. So you get personalized guidance from a coach who leads weekly group sessions. And when you go through the registration process on our tool, you will come to a part on that process where it's going to ask you Monday through Friday. It will give you morning, afternoon, and evening. And once you hit the drop-down box, you can select one of those times. So for instance, if I pick a Tuesday at 8 p.m. in my time zone, every Tuesday the following week and moving forward, I'll have my weekly group class. So that's how the weekly group classes are selected, and that's how you attend those weekly group classes. We also want to make sure that we give you motivation from every which way you can turn by joining our program. So there are motivational resources. You'll get access to a success kit, trackers, fitness on demand, recipes and tips. And of course, you have the ongoing motivation from within yourself, from our amazing coaches and the other group members that are in your group class as well. And our biggest thing that I like to talk about is behavioral change. Now, the one instance or one example I give is I can sit here on the call today, including myself, and I can challenge everybody to lose 20 pounds in a month. Now, can we achieve that goal? 1000% we can achieve that goal. But the way we do it is going to be the improper way of doing so. So right when we get those 20 pounds gone, we're going to get back to our old habits, and we're going to get those 20 pounds back. So with Real Appeal, we build you up slowly over time. That's why it's a year-long program. And what may be uncomfortable when you first start the program, as you move along on week 10, week 26, week 45, it just becomes your everyday norm. So our goal here is to help you achieve whatever goal you're trying to achieve while you're with us, but also make sure we give you the tools that you're going to need to surpass us after you're done with the program. So you can keep on with your journey after us. So we do address topics like emotional eating, mindset, motivation to make that behavioral change possible. Now, this is just a quick little view, as you can see here, of your weekly group class. So the weekly group session, I promise you, it's not I join this link, I hit a play button, it's a pre-recorded coach. It's an actual live person on your screen that you can see, you can engage with. They're all right, she's right there, or they're right there. The cool thing about this setup is you can really, from wherever you're at, enjoy your weekly group class. So you can do it in the comfort of your couch with your laptop or desktop computer, or you can do it if maybe your child has football practice or soccer practice or cheerleading practice, and you want to kind of knock out one or two birds with one stone. So you can put some AirPods in, open up your mobile app, and you can have your group session from the practice field. The coach can't see you. The other members of the group class can't see you, and vice versa. So you can literally sit there in the privacy of wherever you're at and enjoy that weekly group class. There is a lot of stuff going on within the group class with your coach giving you that week's message. So each week the coach will introduce a small topic into the program. It could be like, again, tackle stress and emotional eating, developing your own meal plan, but we call it the building block process. You're able to practice that topic throughout the week, and then you have a new topic added to your program. From my personal experience, it's kind of quiet the first couple of weeks. People are trying to figure out what Real Appeal is, how it's going to work for them. And then let's just say I come in week 4, week 5, and I lost 4 pounds. I'm super excited. I put that in the chat in my group class. Dashboard lights up with congratulations. Your coach is giving you a shout out. That instant gratification of what you're doing is actually working. It's an amazing feeling. Now that you start seeing questions pop in the chat, what did you do different, C. Rico? Was it your exercise, your diet? What did you change up? So not only do you have the instant gratification of what you're doing is working, you can help somebody else on their journey maybe hit their 2, 3, 4 pounds the next week or after. So it does really become like a family atmosphere in there, because you will see the same screen names pop in week in and week out from week 1, hopefully through the duration of the program. So it is a real fun, real interactive program. Now, of course, we want to make sure we give you everything you're going to need to be successful in the program. So first of all, once you attend your first live group class, it will automatically trigger on the back end of your program to have your success kit shipped off to your front doorstep. So when you go through the registration process, it will ask you for a shipping address. We do apologize, no PO boxes, but whatever physical address you put on file, this amazing kit you see right here on your screen will be sent to your front doorstep. So as you can see, and usually arrives around 7 to 10 business days after that first group class. As you can see here, we give you a body weight scale. Now, I promise you, it's not one of those little cheap ones with metal and a little needle just back and forth. It's an actual digital tempered glass body weight scale. We also give you a food scale. So if you do want to go that meal prep direction, we give you that option as well. So you have that available on your countertop. We also give you a balanced portion plate. So a lot of feedback I've heard, people will use that more as a visual on how to bid out their own plate. But the more you build out your own plate with that visual, eventually that plate, the portion plate will disappear in your cabinet somewhere, and you'll just do it second nature on how to build out your proteins, your carbs, your vegetables, your fruits. Everything will become second nature. Now, the last thing we give you, and I believe it was also part of OnePass as well, in the digital plan, but we give you what we call Fitness on Demand, completely free for the complete year of the program. So once you sign up and become one of our family members here at Real Appeal, we give you that Fitness on Demand for a complete year for free. So it's an amazing tool that you have right at your fingertips. All you have to do is go to your respective stores. So you have your Google Play Store for Android users, and you have your Apple iTunes Store for your iPhone or Apple users. So this also goes for any tablet or Apple iPad. You can download Fitness on Demand right there to your device, and now you have a complete workout gym right there from the comfort of your own home. So the best example I can give, I'm Team iPhone, so I can swipe it up, open the app up, swipe up, it broadcasts onto my big screen TV. Now I can do yoga in the morning, I can do stretching, cardio, body weight workout, anything I want to do at home as far as getting my sweat on or my calories burning. I'm able to do that in the comfort of my own home. So you receive all this for joining our program. And also, just to make sure, we want to give you everything you need to be successful in the program. We also have within your dashboard, we have built-in trackers. And once again, you can visit your dashboard by simply, once you become a member, go to realappeal.com, log in with your credentials. It will open up your dashboard. Or you can go to, again, your respective store, Google Play Store, Apple iTunes, download the Rally Coach app. Make sure it's got to be the Rally Coach app. And once you have that on your phone, you can just log in with your credentials. It has your dashboard wherever you're at. So that gives you access to all the motivational messages your coaches deliver. You can message your coach from there. You can access your weekly group classes from your dashboard. You can change up your weekly group classes from your dashboard. Everything is right there at your fingertips. And again, you can also track your activity. You can track your food intake, your activity intake, your step count, your weight, and a bunch of other things you can do within that dashboard. And then, of course, we thought about everything. We've taken the advice and the feedback from our members from the last 10 years to today. And we do know that there's an app for everything these days, and there is a device for everything these days. So if you have an Apple iWatch, if you have a Fitbit, a Garmin, if you use a certain third-party app like Map My Run, MyFitnessPal, they're going to be compatible with our dashboard. So as soon as you log in, maybe you have a Fitbit on your wrist, log into your Rally Coach app. On the very top right next to your name, you'll see a drop-down box. Look for whatever device or third-party app that you use. It will ask you to log in with those credentials on the Rally Coach app. And now those are synced together. So whatever you do in Map My Run or MyFitnessPal, or whatever you track on your Fitbit, will automatically translate over to your Rally Coach app. So whenever you open it up, it's right there to look at. So we really want to make sure we give you everything digitally and physically and motivationally to be successful in our program and really hit the goals that you're trying to achieve. I know it said at the very beginning we're a weight loss program, but we have evolved into so much more than just that, because we do really want to make sure we get you from the top of your head to the bottom of your toes. And what I mean by that is we want to make sure we get your mind right, your exercise right, your eating habits right. We want to make sure we do it in a holistic approach to make sure that you are able to achieve the goals while you're with us and to take that away once you're done with us. So with that being said, we always like to end with Real Appeal has helped members lose 5+ million pounds and counting every single day. And this is just one of very, very, very many of our success stories. And as you can see here, Brianne really needed to make a change. She decided through the program that her company offered that she was going to try this this new program out, and she lost 35 pounds with Real Appeal. So with that being said, I want to thank you for some of your time. And to finish up, if you want to get started today, tomorrow, whenever you're ready to make a change, don't think because we're almost in November, you've missed 10 months of the program. When you sign up and when you register for our program, that's when your year-long clock starts. So if I register today, a year from today is when my program ends. So take a screenshot of this, write down the URL, enroll.realappeal.com, pull out your phone if you're allowed to at work, scan that QR code if you're ready to get started today, and start the registration process. But I want to thank you again for having me on your call today. And what I'm going to do now is stop sharing my screen. And I'm going to open the floor up to any questions if there are any.
Thank you so much, Christopher. That was a wonderful presentation about Real Appeal. Very excited about that program. Don't see any questions that anybody has submitted, but if we do get any questions in the remaining of this presentation, I'll let you know. So I'm gonna go ahead and share my screen, and we're gonna go to the next presentation. This is Nikisha Montgomery, and she is our account manager with RX Benefits and Express Scripts, and she is going to talk to us about RX Benefits. So Nikisha, the floor is yours. Thank you. Nikisha, you muted?
Can you see my screen?
Yes.
Okay. I am RX Benefits, your pharmacy benefit manager, and today we're going to talk about the new member portal experience.
Nikisha, you muted again. I'm sorry. I'm sorry to cut you, but I don't know what happened. It got muted.
I keep hitting the button. That's all me.
Thank you.
We're going to talk about the member portal experience. It provides 365 days, 24 hours a day, access to your pharmacy benefit. You will see your prescriptions processing in real time. Any questions or concerns or any calls that you make into our call center will also be labeled on the portal for you. It allows members to have self-service. You can chat with agents Monday through Friday, 9 a.m. to 6 p.m. outside of holidays. And like I said previously, when you call, any information that you spoke with the representative will also be on the portal. It's not an app. It is a web-driven tool, but you can access it 24/7. We have people manning this portal 24/7, but the chat is available 9 to 6. So if you reach out on the portal outside of the 9 to 6, a member will get back with you the next business day. You can use it on your tablet, your desktop, or your mobile device. One of the most useful and most used tools on the portal is following your PA process. So if you have a new prescription or any medication that requires a PA, once your provider submits that PA, you can see it on the portal. You can see if it's been approved, been denied, what we're waiting on from the provider, and what you're approved for. It will provide all the NDCs that you have, the time frame, and the dosage amount. A lot of members find this very, very helpful. How do you register for the portal? Again, you can register through your computer, your tablet, or your mobile device. Visit the website, www.member.rxbenefits.com. You will be asked to provide your contact information, and this is for all covered members, their dependents, and spouses over 18. Once you are registered, Your access will look like this. It provides a quick and robust of all your claim data for 18 months for you and your dependents and spouses, your coverage, and you can also see any chats that you've had with an agent. You also can get a copy of your ID card if you need one immediately for the pharmacy. It will also provide contact information, how you can contact us, and other member resources. Also, you will see your prior authorization status for 18 months as well. You can see what's happening with your PA in real time. And if your PA is denied, you will also be given the alternate therapies that are suggested for you. Short, but I am done. Are there any questions?
Yes, there is one question for you, Nikisha. The question reads, can we still use the Express Scripts app, or do we need to go to the RX benefits in 2026?
You can use both.
Perfect.
But I always advise members to use RX benefits just because we have their relationship, and the number on the back of your ID card is for RX benefits.
Perfect. Thank you so much. I don't see any other questions here. Again, if we do have any other questions during this call, I will let you know, Nikisha. Thank you so much for your time. That was a wonderful presentation. Very important for us to know about prescription. We're going to go ahead and move forward to the next presentation. And this will be Doug Montgomery. He is our camp manager with Tria Health. And this is the diabetes support program. So Doug, the floor is yours. Thank you.
Hi, Marianela. Thank you very much. We partner with, hi, everybody. I'm Doug Montgomery. We are your Optimize My Care Diabetes Support Program folks. We're the back end of our partnership with RX Benefits to provide support for folks along their health journey dealing with diabetes and then metabolic syndromes. More on exactly what that is here in a moment. I want to provide you with a little background about Tria Health. We are a pharmacist-led chronic condition management company. We help plan members manage your health through smarter medication management. So the whole Optimize My Care diabetes support program was designed to help optimize medication regimens, since drugs are those primary treatment methods that doctors issue in order to keep chronic conditions such as diabetes and metabolic syndromes at bay. We want to make sure you're adherent to those medications. We want to make sure that you're getting the health outcomes that your doctor wants you to have, which is the whole reason why he's prescribing what he's prescribing. We also want to make sure that we help with health literacy. You'd be surprised at what we can teach someone who's been dealing with a chronic condition like diabetes, even though they've been doing it for a long time, how we can help make those improvements. Because we want to understand each member holistically. I heard that holistic term from one of your other vendors earlier, but we really truly do that. You come to us with diabetes or a metabolic syndrome, but we're going to talk to you about everything that you're ingesting for a condition. Maybe it's an over-the-counter drug, maybe it's a vitamin. We want to make sure we understand your lifestyle, your behaviors, what those habits are like, so that we can best provide you with guidance on how to keep your conditions well controlled and your health the best that it can be. Because we know that if we manage care effectively, we can help folks lower overall medical costs and have fewer visits to the doctor, the urgent care, or even, heaven forbid, the emergency room. So this program is for folks who are dealing with diabetes or any of these metabolic syndromes that you see on screen: heart disease, high blood pressure, high cholesterol. This is for employees, spouses, and dependents who are on the health plan through TAC. So if this sounds like you, keep your ears perked up as you could qualify for the program. If you are eligible, this is how the program works. We start with ingesting all of the RX claims information from our friends at RX Benefits that are from folks that are on your health plan. So any prescription that you're filling, we're going to be made aware of it. And we're looking for folks filling meds for diabetes or those metabolic syndromes. We then will outreach to you to schedule a consultation with one of our pharmacists. There is an incentive to participate, so you're not just doing it for your health. There's another good benefit that I'll talk more on here in a moment. But following that consultation with a TRIA health pharmacist, you will receive a custom care plan that's addressing all aspects of your health. That includes information and recommendations that can be shared with your physicians or your team of doctors. You'll also be given instructions on how to utilize our TRIA Health app to the fullest potential, from tracking your health and seeing your med list and accessing your care notes, to scheduling appointments with us for the next time around for your follow-ups as needed with your pharmacist. It'll all be there in an email sent to you following that first initial consultation. And then that pharmacist here at TRIA Health is going to be your personal pharmacist that you'll speak with each and every time you have a consultation with TRIA Health. So what does that look like when you're talking with your pharmacist? So first of all, these are consultations that are over the phone. They are one-on-one, and they are completely confidential. We don't share any information with your employer. We don't even share any information with any family members. We value HIPAA and the restrictions and the rules, and your PHI is confidentially kept and only shared with you. So we're going to make sure that in those consultations that your medications that you've been prescribed are working correctly. We're going to provide answers to all of your questions that you might have. We're going to make recommendations as we see fit from our doctors of pharmacy. We're also going to coordinate care with your physicians should you need us to. If you don't want to make a trip back and have a copay and have a doctor's visit to relay information that we're making as a recommendation, we'll handle all of that over the phone and call your doctor directly. It's very important that we're on the same page as your health team for your health as you're going through this and dealing with your chronic conditions. And we're always going to look for opportunities for plan members to save money. If we find a duplicative therapy that we don't think is necessary, and you're taking something else that will still keep your condition well controlled, we're going to make that recommendation, for example, to your doctor to cut one of those things out of your drug regimen to make it simpler and to help you save money at the pharmacy. As I mentioned earlier, there is an incentive to participate. So aside from having a wonderful pharmacist at your beck and call to help guide you through your health conditions, you also get a $50 gift card for every consultation that you complete with us, up to 3 in a plan year. So your first initial consultation, you complete that, you'll get a $50 virtual MasterCard to spend wherever MasterCard is accepted. You do your follow-up, say 6 months later, you'll get a gift card there. Should you need a third, we will give you a gift card upon completion there. Now, say if you're someone with a rather complex health history, you're taking a lot of medications, you're dealing with a lot of doctors and a lot of chronic conditions, you might need to meet with us more than 3 times in a plan year. That's totally fine. You can meet with us 4, 5, 6 times, however many you need to have that support from your pharmacist at TRIA, you can have. We just won't spiff you that gift card past your 3rd completed consultation. So hopefully that makes sense. Again, this is it. This is for any employee, spouse, or dependent who qualifies for this program that can take advantage of this incentive. So what should you expect when you're identified? Once we find you as eligible for the program, this is kind of what that member journey snapshot looks like. It starts with our enrollment packet that's going to be mailed to you directly. It's going to include a letter that identifies who we are. It's going to be co-branded with TAC's logo and sent on behalf of TAC, so you'll recognize it as a part of your health benefits. In fact, I have the next slide. We'll kind of give you an idea of what that letter looks like. Then we also include an enrollment form and a prepaid postage envelope for you to complete your enrollment form and mail it back to us to get that consultation, that first one, scheduled. Should you lose it or it gets thrown in the trash inadvertently, that's okay. We're going to follow up with phone calls and emails, and we're even going to send additional postcards mailed to your house. So we're going to give you plenty of opportunities and ways to get enrolled, and that does include you being able to go online. So you can go to our website and fill out that exact same enrollment form digitally that sends to us instantly, and then we get you set up that way. Or if you need further assistance, you can always give us a call, and one of our friendly member advocate people will answer that call, intake all of your information, and get you set up with that first consultation. From there, I've kind of touched on what those consults look like with our pharmacist. All of our pharmacists are doctors of pharmacy. They're also certified diabetes educators trained in motivational interviewing. So they're going to make sure that we totally understand the whole picture that is you and everything that you're dealing with every day to get those recommendations that we're going to make right for you. From there, we're going to have that care coordination and follow-up. If we need to talk to your doctor, we will. We're definitely going to send you notes via email to get signed up with your profile and set up the app and get these recommendations at the touch of a button through the app. You can share them with your care team as well. So we want to make scheduling and getting started with TRIA as easy as possible. We are here located in Kansas City, Missouri, so Central Standard Time. We're open Monday through Thursday, 8 a.m. to 9 p.m. We're open Fridays until 7 p.m. And then we have very generous hours on Saturday for you all from 9 a.m. to 5 p.m. So should you want to have that consultation with your pharmacist in your pajamas on a Saturday morning with a cup of coffee, we highly encourage that. So we just want to make this as easy for you to get engaged in the program and take advantage of the free benefits that TAC is paying for you to take advantage of to keep your diabetes and your metabolic syndromes at bay. Something else I'd like to touch on with this is you might come to us for diabetes or one of those metabolic syndromes, but if you have another chronic condition, whether it be a respiratory or osteoporosis, for example, we're going to address those chronic conditions as well, because we never want something that you're taking for another condition to adversely affect another condition that you're trying to keep at bay. So we're going to kind of go through everything with that. I will say that that does make our first consultation with you a little bit longer because we're getting to know everything about you in that first conversation. So it's going to be closer to 40 minutes. Any follow-up consultations are going to be closer to 15 to 20 minutes just to make sure that everything's going okay, that you didn't have any issues with the recommendations that we made, that your doctor is still on the same page with us. All of those things that are going to go hand in hand in being your guide along your health journey. That is everything that I wanted to share. Marianela, is there anything that was in the chat that was a question for me?
We don't have any questions at this moment about TRIA Health, but if we do in the future, Doug, I will either email it to you or let you know on this presentation. Thank you so much. That was
Great.
a wonderful presentation.
No problem. And if you don't mind, I do need to jump. I have another meeting at 2:30, but it was great to be with everybody.
Thank you, Doug. Thank you for your time.
Yep.
Okay, I am going to go over the resources for living, the employee assistance program. This is a support that we have for you for the overall well-being. What is Resources for Living? Resources for Living is our employee assistance program that we partnered with. It is a starting place for addressing personal issues, for example, anxiety, stress, any other mental health issue that you may have. You can contact them and they will be able to walk you through it and in a confidential way support you in an overall well-being. It is free, 6 sessions per issue per calendar year. Okay, and the access also includes in-person, virtually, or over the phone visits. Who is eligible? Clergy that are currently enrolled, as well as their dependents, even if they're not enrolled, laity of the Texas Annual Conference lay employees, as well as clergy who are currently serving at a part-time 50% or lower that are not enrolled in the health benefits plan can also participate in the EAP program. Also, children up to age 26 who also live away. So if you have children who are off to college that are away from home, they can also benefit from these services. And so what is actually included? The counseling services are unlimited, okay? But it is 6 sessions per issue per calendar year, okay? For example, if you have an anxiety issue, that is one of the counseling services that you can take advantage of. So you'll have 6 sessions for the anxiety per issue per calendar year, okay? And you can call the 1-800 number up here on the screen, or you can visit their website and log in with those credentials on the screen. And it will direct you on how to proceed with requesting a certain counseling service, okay? And this is at no cost to you or your dependents. Again, the sessions can be in person, they can also be virtually, or they can be over the phone, okay? You'll also be able to have legal and financial consultations. This is a 30-minute free consultation with a legal or financial expert. You also have work-life services that help you find resources that are available to you around where you live. For example, you need to find daycare or summer camps, or you need to find an elder care, home health, assistance living, Medicare or Medicaid issues, transportation issues, etc. You can do all that through Resources for Living, and they will plan and help you navigate on what's surrounding your home and what's available to you. Again, you can go online, visit the website www.resourcesforliving.com, and they carry a wide available of articles. They also have videos that you can listen to and see. They have podcasts, they have live on-demand webinars, as well as assessments that you can take to see what services you can ask them for help. All this is available online through their website. You also have a self-care mental well-being app that's provided to you to focus on activities that can help you relieve some stress, anxiety, depression, etc. So I encourage you to either call them if you're having any of these issues, any mental health issues, as well as log into their website and see what's available out there. The services are confidential, and we do not get any reporting of this. They are available 24 hours a day, 7 days a week. Again, the phone number is 800-492-4357, or you can access their website and log in using the credentials, or you can also download their mobile app called Resources for Living from your device's app store. This is what I have for the Employee Assistance Program. I thank you for your time. The following item we would like to enhance, and that is tomorrow's webinar. There are going to be 2 webinars tomorrow, one at 1 p.m. and the other one at 2. The first one will be the high deductible health plan with Ryan Johnson. He's going to walk us through what the high deductible health plan is, as well as what the health savings account is as well. And then at 2 p.m., we will hear from expert Michael Steele, and we will see the Medicare session, and he will help you walk through along that. If you need those webinar links, please take a picture of this QR code, and you can find the webinar links there. Another webinar that I want to highlight is next week. A week from today, it is the Compass Plan, and it's going to be a soft transition into 2026. That will be November 4th from 1 p.m. So I encourage you to attend. Let your church personnel know to attend as well. It's very important because it will be changing for next year. If you have any questions, please feel free to reach out to us. Feel free to reach out to Reverend Robert Besser, myself, Marianela, or Mark Hellums, or Patricia Goforth-Quakes. And we are here to support you, to walk alongside you, and anything you need, please reach out to us. We thank you for this time, for this webinar. Thank you for those that attended. Thank you for the great presenters that we had. We encourage you to attend tomorrow's webinar as well as next week. And if you have any questions, please feel free to email or contact us. Thank you so much. Have a wonderful day.